Welcome back to Living 808. Running, chasing a ball, or catching a frisbee are all great exercise for dogs, but it can also result in injuries, and they are more common than you might think. Now, here to talk about pets, orthopedic injuries, and surgery is Dr. Joseph Edlin with Gentle Vets Hawaii Kai, and we've got Doc here as well. I'm always happy to see you, Dr. Edlin, but I'm always very happy to see Doc because he is just such a beautiful dog.
He's a pretty special boy. He's just so totally relaxed and so cool. And
yes. During the commercial break, he was on the floor laying on his back, and you just want to go there and love him up.
Yeah. Plus he's away from Rosie, so he doesn't have to put up with her abuse today.
He does seem a little more calm today, yes. Okay, so we're talking about orthopedic problems today. What are the most common orthopedic problems for pets?
Okay, the first one we want to think about, especially in a large dog, is the hips. And I would not look at acquiring a large dog without having a look at their hips, because it's going to be a nightmare if you don't look into it. Good hip looks like this. It's nice and smooth. When you get an arthritic hip and from hip dysplasia, it's going to end up like this. It's going to be very, very painful, a very expensive procedure to correct. The corrections are good. We can do a total hip replacement. There's only a couple docs on island who are doing total hip replacements. We're biometric certified, where we actually put in a titanium stem and a polyethylene cup. They're very good. They're very good procedures, but they're difficult, expensive, and like I say, not many people are doing them.
When you say you wouldn't buy a big dog with hip problems, how do you know they have hip problems? Do you look at their
Wonderful question.
Parents?
You look at their parents, and I hear so many times, oh, I saw the parents running around in the backyard, they're fine. They are not fine necessarily. You have to get x-rays of their hips. You've got to get the x-rays of the hips. I remember one dog that we had came into the clinic, and he comes leaping up the stairs. His hips were completely luxated. They looked like this. Actually, it was luxated. It's up out of the joint. But his hips were horrible. But if you look at him run, he was doing okay on those hips. So look at the parents' x-rays. You've got to get x-rays of the parents. And we looked at Doc's parents' x-rays, and they're good hips. So I know I don't have to, there's a really good chance I won't have to worry about the hips.
Okay, aside from hip dysplasia, anything else?
Okay, the next thing that we have to look at is the knees. And by the knee of a dog, the stifle, is definitely the most problematic place in the dog's anatomy as far as orthopedics. And the problem is that as the dog walks, here's a model of TPLO. As the dog walks, he's constantly, so you see he's got a bent knee. We walk with a straight knee. And the dog walks with a bent knee, and every step he takes, he's stressing a ligament that's supposed to hold this in place. And so he's stressing that cruciate ligament back and forth, and literally every step he takes, he's stressing that ligament. And eventually, in a lot of dogs, that will break. And so then it has to be repaired.
So how can you treat hip dysplasia and, say, knee injury?
Okay, if it's a cruciate ligament injury, basically they need surgery. There are other things we can do for the knee. We've got joint injections. We've got Adequan, which we give intramuscularly. Previcox is a wonderful drug to alleviate inflammation and pain. But ultimately, most knees are going to need surgery.
We're almost out of time already, but what are some of the signs? Because obviously they can't talk to us. How do you know that it's hurting? Or
one of the most common signs you see with a large dog, even small dogs, is the unwillingness to jump up into the car. Where they used to be willing, okay, to jump up into the car. In fact, I use that as a lameness test in the clinic. I go to the steps always, and if they're having a funny way of getting up the steps, they're going to have some sort of rear leg injury. If they're having a tough time getting down the steps, it's going to be forelimb. So you just take them, walk them up a stairway, and if they're unwilling to go up the stairway, you've probably got some problems going on in the back end.
Okay, thank you so much. And you do everything at your office, right?
Yes, it's interesting because each one of these procedures, TPLOs or total hips, we have to go away for special coursework. This is after years and years, decades of experience doing orthopedic surgery. Then we have to go away and take a course in TPLO or in total hips. And so we do all of this at our hospital, yeah.
Yeah, well, we appreciate you doing all those studies and furthering the education because, you know, they're part of our family.
Oh, they sure are. And I'll tell you, it's not nice when they get lame. It hurts.
No.
It hurts.
And she's obviously very relaxed right now, Doc. All right, coming up on